Hi everyone. Today we are going to read about two different experts expressing their thoughts on active duty military. The topic is to explore whether PTSD leads to divorces in the active duty military. It is important to perform further studies in this matter because, according to USA Today, there are nearly 30,000 marriages ended in the US Army active duty component. Furthermore, researchers have shown that according to the length of the deployment, the divorce risk has increased as well. Therefore, it is important to perform further studies on this subject and find possible effective methods to overcome and/or to decrease the rate of divorces in military families. There can be possible controversies in this research area. There might be arguments where PTSD does not have any relation to divorces rate in the military. Dr. Amila Delano was born and raised in California. She spends most of her time working with active duty military soldiers as well as retired veterans. She currently works at an outpatient behavioral health clinic in Hawaii. Dr. Olivia O'Sullivan was born and raised in New Mexico. At first, she was a military wife. Later down the road, she knew that she wanted to help soldiers. She became a clinical psychologist. She is also currently working at an outpatient behavioral health clinic in Hawaii. She has 2 children and her husband is currently deployed. Though there have been discussions on PTSD affecting divorces in the military, she believes that there is always room for improvements. She hopes there will be more research on this matter. She thinks that there should be a research done before and after deployments and their relationships. In that way, there might be some information that is valuable towards concluding that PTSD leads to divorces in the military. Dr. Delano is willing to help active duty soldiers to overcome their relationship hardships and to design treatment plans for the individual as well as families to follow. Dr. Delano has been working with active duty soldiers for about 10 years. She worked at Veterans Affairs Hospital as a clinical social worker. She is more than happy to guide the soldiers in the right direction to get help if there is something that she couldn't do. Therefore, one of the websites she uses to help soldiers who are about to leave the military or who are already left is given below. Dr. Delano stated that she used this website not only to help them figure out what happens next, as well as to let the soldiers know that even though they are getting out of the military, there are still helps available for them. Dr. O'Sullivan highly thinks that there should be more psychological researches on the active duty military soldiers and their families. Furthermore, she thinks that there are other things that can affect unstable, unsuccessful marriages in the military. In addition, she mentioned about how deployments can affect the offsprings of the military families. According to the research, children from families that have 1 to 2 deployments have more health concerns compared to children from families that have more than 2 deployments. Researchers stated that it is almost as though the children are built a resilience with their parents' deployments. Dr. O'Sullivan currently working with a patient who has been diagnosed with PTSD and experiencing some relationship difficulties. She stated that she provides individual as well as couple therapy for both the patient and his wife. She mentioned that she has been seeing positive progression during and after therapy sessions. Dr. O'Sullivan has been married to her husband for over 20 years. She stated that being dual military is one of the most challenging things she has done in her life. She recommended the Military One source as a good source for military personnel and for their families. The webpage gives many different information about many different categories such as financial, legal, health, housing, and so on. Dr. O'Sullivan stated that Military One source has helped her and their children very much, especially when her husband is deployed. Even though both career paths are working under the same umbrella term psychology, there are some differences between the 2 careers. According to experts, psychologists lean towards observation, interpretation, records people's responses, relationship and behaviors in their environments, interview patients, perform diagnostic testing, and provide psychotherapy. A licensed clinical social worker can do very similar tasks, including develop plans to improve personal well-being, make referrals for places where the patient can get even more help, such as food banks, and develop care plans. Even though they have many things in common as mentioned above, one thing that stood out is that both providers direct therapy to individuals and their families.